dedicated himself to our safety. Officer Inget had been previously commended in a life-saving act, and we honor his memory. And when his passing was announced, the Bainbridge Island Police suggested that the best way we could honor his heroism and for us all to do our part in the upcoming days to try to prevent further deaths due to COVID-19. The officer was being treated for COVID symptoms. We don't know the exact cause of his loss, but we do know that we all have a chance to honor him in the next several days by continuing to socially distance, by continuing to protect ourselves and our families and our loved one and our broader community. And we know that it takes a little bit of common sense to do that. This weekend, obviously, is a time where we would like to have close communion with our families. It's a time we would like to have comfort physically being with them. In the middle of Passover on Good Friday, with our kids and grandkids wanting to have an Easter egg hunt, we understand those things. But this is really a moment for all of us to redouble our efforts and our commitment to our families and our communities to stay safe, stay home, and stay healthy. I was sort of struck, and I know people have heard these other stories that I have heard about these tragedies where maybe one person has gone to a birthday party and ends up infecting others, or a choir has a practice and it ends up infecting, perhaps dozens of people. And we just do not want to have stories of Easter or any other get-together of people being infected on such beautiful days. And the way to make them more beautiful is to stay home and be just with the folks in your immediate household. Because we know all it takes is one person, one time, at one get-together to infect other people and cause an unnecessary death. We know that our only weapon against this COVID virus is social distancing, and it's something we ought to use. I particularly want to address the fact that all of us enjoy beautiful Washington being outside. And we still believe that going for a walk on the block around your house is something that makes sense if you walk alone or at a good distance away from anyone else. But I do think it's important to realize we can't have people congregating in large numbers at trailheads and parking lots for parks and the like. That's why many or most of the parks have been closed, because infections can take place in any group of people, even if we're smiling and we got our hiking boots on. So we hope people use extreme care in this regard. I heard one group suggest that if to get to your walk you have to drive a car, then you've gone too far. This is a moment to enjoy a blue sky close to our home and walks around our home. Please don't congregate in some place where it can be beautiful, but you can be infected. Again, I want to reiterate that this battle is one fought by individuals, not just the power of government. These are things that we are succeeding on because we've had so many Washingtonians follow the health directives that we have all heard, and that's good news. But now as the sun is coming up and coming out, it is more important than ever to hew to this advice. Today, I also wanted to share with you some of the information that suggests why this is so important. I wanted to share with you some of the data that has been gathered and models and projections that have been done at the Institute for Health Metrics and Evaluation associated with the University of Washington. This group, we're so lucky because this group really has been, the world has been following the modeling that this group has been done, taking data from all around the world and building models to help policymakers around the world to make decisions. We're very appreciative of their efforts. The first slide I'd like to show you, it shows the deaths per day in Washington up to April 8th, and I believe that number is 477, I believe, till today, a little higher than is on the chart. This chart goes through April 8th, and you'll see the rise over time. The second chart I'd like to share with you shows the projections for deaths per day if we continue the physical and social distancing that we have been committed to so far in the state of Washington. You'll notice that the curve of deaths per day goes down. This shows why social distancing is so important, and it shows that according to this model, we can do really good things in the future because we have done good things in the last couple of weeks. But the third graph is really important. This third graph shows what would happen if we all abandoned our social distancing even 2 weeks from now. So if we stop doing what we're doing 2 weeks from now, you'll notice what happens. The curve goes back up and you have more deaths occur. The fourth graph is the same as the previous one, but it includes shading under the line just to give you an idea of the number of deaths that will be preventable if we continue our efforts on social distancing and will result if we do not. And I think that every one of these deaths is a tragedy. Every one is a loss of a brother or a sister or a father or son or daughter. And this graph is a really good reason we should continue our efforts. The fifth final graph shows what is likely to happen according to this model if we were to stop social distancing today and everyone just goes back to congregating at trailheads and going to family events where we're close to one another. And the magenta line shows what projected deaths would look like. More deaths. This is simply unacceptable in our state. We're better than this. We understand science. We have demonstrated our ability to socially distance and still have productive lives. We've demonstrated the ability to communicate with our families electronically and be a little creative on how we express our love for one another. And so let's not let those lines become a reality in the state of Washington. Our state has been united, and I've been in close contact with leaders across the state of Washington every day on how we move forward. And I have some leaders today that I wanted to join with us and share some of their observations about the days to come, particularly regarding how we travel or don't travel and how we recreate. We have Ocean Shores Mayor Crystal Dingler, San Juan Economic Development Council Executive Director Victoria Compton, Yakima Mayor Patricia Byers, Executive Director of Dishman Hills Conservancy in Spokane Valley Jeff Lambert. And I'd like to give them each a chance to talk about why it's important to limit the number of folks congregating and continuing really innovative ways to enjoy our lives. And I want to start, if we could ask Ocean Shores Mayor Crystal Dingler. Madam Mayor.
Thank you, sir. I'm experiencing a little screaming on my computer now right now. Anyway, I wanted to start off with the 10 confirmed cases that we now have in Grace Harbor County. We had 2 in March, and now we have 10. That's a frightening number for us in rural America. I urge people to stay home and stay healthy. The order is just so essential for all of us right now. And I appreciate so much what the governor has done. I don't always agree with the governor, though I think you're wonderful. But this has been amazing. You've done a terrific job, and we have come through this. And I know we're not at the end yet, but we have come through it amazingly well when we look at other communities. So I thank you. Grace Harbor visitors and residents, to remain healthy, we need to continue social distancing and staying home. It's really important to all of us that people from an infected area or from any area, because any of us can be infected, don't come to Grace Harbor County. We're struggling. We have limited resources. So please, we love you. Come back, see us in the summer when things are better, but this is not the time. I'm very proud of our Grace Harbor Public Health Incident Management Team. They have done such a terrific job. Even though we don't have the numbers of some of the bigger counties, they still have to take all of the steps and do all of the things, and they've just done a wonderful job. They have provided us daily reports. on what's going on. They work closely with healthcare. They have worked closely with the state, and they keep the state informed of what their supply needs are, and I think that's really important, and particularly for our long-term care units and our EMS folks who are burning through supplies at an amazing rate because they have to change them between each call, and they have to go to each call as if it is the virus. So they're all just really working very hard, and I appreciate that. Their emphasis for the week is a goal of having a community-based test here, having a site here. We have not had that in our county. We've not done a lot of testing because there were other areas of the state that had bigger issues than we did. For Ocean Shores, what I have done is to shut down our hotels to discourage visitors. The RV parks and other nightly rentals are all shut down. We closed our beach approaches along the county. We had 5 approaches, they had 7. So people can still come out and walk on the beach, but they can't drive on the beach, and it's less accessible to people. And again, this is to discourage people from visiting. And I'm sorry to say that, but it's what we need to do now. We've also instituted a curfew, and that curfew is in place from noon until 5 o'clock. Midnight until 5 o'clock, and it helps us tremendously. We have a small police force, so we've to do that. And our folks, we had a little problem with it. There were a few people that felt like, wow, a curfew in Ocean Shores. But it's worked for us, and I think that it's necessary. We've done layoffs, notices to our people of layoffs and cutback of hours. We have to give 30 days notice, and we've done so. It involves almost half the people working for the city, most of those with cutback hours. But when your library is closed and your construction is shut down and all of these things, nobody's coming certainly to our convention center right now. We're not active in those areas, so we have to be really careful because our income has come down tremendously. The good things that we've been doing in Ocean Shores, our people are amazing. They are volunteering in droves and doing all sorts of things to help their neighbors and help their friends and make sure that everybody is taken care of. The city has started a feeding program. We gave out 200 and some meals a day in the last week. We're doing everything we can to make sure that our citizens are safe and well and that they stay healthy. I've been talking to a lot of our other local leaders, and they're very concerned as well, and they expressed some of these concerns. But first, I want to thank the Quinault Nation. They were one of the very early ones to shut down their hotel and shut down their casino, and I really appreciate that. That was just a necessary step, and they just stepped right up and did it. They didn't wait for someone to tell them to do that. Positive impacts on the community. Again, that power of community is just amazing. People are doing such a wonderful job. On the other hand, there certainly are those who are expressing judgmental behavior. And that judgmental behavior is hurting us in a variety of ways. It's so discouraging to people. We don't know why someone might be out or why they might have to go to the store. We have to make sure that we are considerate of them as well as ourselves. The negative impacts, again, the burden on our small businesses is really tough. It's a tough one. And our budget concerns are big. We're not eligible for the municipality liquidity facility funds. That's a federal program. We read it with great interest, and it takes care of the big boys, but not us little folks out here on the hinterlands. So we're concerned about that. We're hoping that there will be another federal something that will come by and help us out. We take the issues seriously. We're concerned. We support the Stay Home, Stay Healthy program. We support our local businesses. I know some of our businesses, our golf course, for instance, is very concerned. They feel like they can practice distancing and they would like to be starting up again. Our construction industry, the same. But stay home, stay healthy. We love you, but please don't come visit us now. And now it's my pleasure to introduce Patricia Byers, Mayor of Yakima. Patricia?
Thank you so much. I appreciate that. We want you to know, Governor Inslee, that we are also abiding by the stay home, stay healthy order. And I want to, first of all, express appreciation to every member of our community who has made efforts to comply with these safety measures, because it is one of the most effective things that we can do. So thank you for that order, and we are operating under that. We have had a tremendous amount of volunteerism in our community. We have individuals shopping for the elderly or shopping for other people who can't get out. We have companies making hand sanitizer and other things that we need, PPEs, and we have individuals in the community doing that as well. So it's been a great community response while practicing, the safe distancing. And so we're trying to be really cautious about that. We also are a community that relies heavily on both construction and tourism. Those are two of the biggest economic factors in our community. So we have a lot of struggling people and great concern about businesses going on right now because they're not able to continue building the homes and residences that we absolutely need for our housing shortage, especially affordable housing. And then our tourism industry is basically shut down, except for our hotels, which are housing people coming into the community, emergency service providers, health workers, military, who are here to help the situation. Otherwise, they are.
Madam Mayor, we may have lost you a little bit. You didn't happen to hit a mute button by chance? We're just, if people can bear with us just for a minute, we're working through some. We think the problem is Olympia, not Yakima here. That's not a metaphor.
You're hearing them. They're doing fine. It's going out. Your problem is here. Okay. Well, that's good. That people are still getting. How do we know when they're done? All right. So the feed is still getting.
Could we go a speakerphone route? Okay.
I think the important thing is that the people watching and listening are still getting her information, right? Okay. Yeah. That's much better than the impacts on interpreter.
So is she still speaking?
Yes, sir.
Good.
And we're also a tourist area, and if you're thinking about coming to Yakima for the weekend because you want to do some wine tasting or beer tasting or enjoying all the spring foliage here, please don't. We love our tourists, but this is not the time to come. And, come in the future when we're open. We appreciate that because we rely so much on your being here, but we're asking you not to do that right now to help protect our community and our families. So thank you very much. Oh, and I'm supposed to introduce, I believe, Victoria Compton. Victoria, are you there?
Yes. Thank you so much, Patricia. And I'm Victoria Compton of the San Juan County Economic Development Council. Governor Inslee, state and local legislators, and fellow Washingtonians, I have a plea. Washington State, our local leaders, our emergency and healthcare workers have done a fantastic job of keeping us safe, and it's heartening and relieving to see that it's working. Because the alternative is unimaginable, we are very grateful for the work that they're doing. We've all come such a long way, And it's been scary and incredibly hard for everyone, for our workers, our seniors, our business owners, our moms and dads and kids and everyone. As a third-generation Washingtonian, I'm proud to stand with everyone in the state as we work to get through this. And we will get through this. It's what Washingtonians do. In order not to go back to the place we were just a few weeks ago, we need to stay strong. We need to stay home. We need to stay well. I want to let all of our visitors know that us Islanders love you, and we're excited to see you return after the stay-home order is lifted. We're eager for you to get here, but after the order is lifted. Check out islandsstrong.com and visit sanjuans.com to start planning and dreaming your next visit. And to all of our hardworking Islanders and business owners, I'd like them to know that it's critical for us to maintain the stay-home order right now. This has been unbelievably distressing for our businesses, but the alternative of not maintaining the stay-home order right now is not imaginable. Don't want to go back to that same scary place from just a few weeks ago, when we were all terrified and we all wondered if we would make it, if our families would make it. I don't want to go back there, and I know you don't either. The immediate hit to our economy is enormous, but it won't be as huge as it would be if we have repeated outbreaks by not getting it under control right now. I know that we can do this. We're Washingtonians. Stay proud, Washington, and stay home. And now I'd like to introduce Jeff Lambert, the director of the Dishman Hills Conservancy.
Thanks, Victoria. And thanks to Governor Inslee for his leadership in taking tough action to stop the coronavirus. The Dishman Hills Conservancy encourages outdoor recreation for exercise and mental health. Our trailheads are perfect for easy access to the outdoors. We appreciate the governor recognizes outdoor activities as essential. Our local trails and parks are open. In Spokane, the city and the county, we all agree one should walk, run, or bike to the trail or park. Try not to drive. Adventure outside your neighborhood can wait. We're also concerned about congestion and physical distancing. Our parks and trailheads across Washington are quite busy. You must avoid congested areas. If the parking lot is full, go elsewhere. Some say it's easy to do physical distancing. Being patient on trails that are only 2 to 3 feet wide is kind of hard. You may have to pause to give others a chance to get off the trail or pass safely with at least 6 feet of separation. One may have to give up pacing or mileage goals. This is a time for community health. If we all practice physical distancing, during our outdoor fun, we will return to normal much faster, as the governor's projections show. So thank you, and I turn it back over to Governor Inslee.
Thank you. I think you see the breadth of sentiment of how we love our communities enough to pause our enjoyment of them a little bit. And I just want to compliment the local leaders. I was just thinking of Mayor Dingler of Ocean Shores, whose vast economic lifeblood is tourism, to make a decision that she has made to try to save people's lives at the cost to her community's economy. That really is a tough call. And it just takes leadership, and we're seeing that all over the state of Washington. 4 of the local leaders are just representative of what we're seeing across the state. It kind of reminds me of the movie Jaws, if you remember Jaws. When the shark showed up, the mayor of the community didn't want to do anything about it because he didn't want to scare any tourists away. Well, we know how that ended up. We have better local leaders in our state, and they're just doing a great job, and I want to commend them and thank them for this discussion today. With that, love to stand for questions of myself or any of our our local leaders here.
First question, we go to Rachel with AP.
Governor, with the federal stockpile depleted for at least a month, are there any additional steps the state is taking to secure supplies, something along the form of a regional alliance or something like that? Also, earlier this week, you had a series of phone calls with a variety of people, including Puritan Medical Products and Hardy Diagnostics. Can you talk a bit about what was discussed in those calls and whether you've reached any agreements with them related to products that we need?
Well, we have had the only way to describe it is a massive influx of orders that are in the pipeline heading to the state of Washington. In the next few days, in the next several weeks, we have procured, I believe the number is 85 million pieces of personal protective equipment. And I think relatively soon we will have a relatively stable stock of that equipment that is so important to our nurses and our workers and our emergency responders. That's been substantial progress, and that has happened because we have scoured the world and have got lucky, frankly, on finding some sources where we maybe, got ahead of the curve, so to speak. We have had discussions with other states. Mayor de Blasio gave me a tip about a way to procure some face masks from a supplier in China. We're working on that. That hasn't been consummated yet. And if we do that, we're going to share whatever supplies come of that with New York City. So there have been some preliminary discussions about alliances in procurement. But I do want to tell you my biggest concern, and you may have heard me talk about this the last few days, and that is testing kits. We are way behind what we need in testing kits. And we have been doing everything possible. We have procured several thousand the other day, but it's not going to be enough. You may have heard about Jeff Baird at the University of Washington helped us procure a new type of swab that can be used in the testing kit, and we hope those will be validated today or the next few days. If they are, that would be a huge boost for us to be able to expand our testing capability. But in order to really fulfill what the state needs and what the nation needs, we need to build a whole manufacturing system in our state and in our nation that does not depend just on imports from around the world. There's too much demand around the world. So we are intentional trying to figure out how to build a domestic supply system. The state has been in some discussions with Amazon, which is starting to talk about how they can develop their own in-house, if you will, testing system. I believe Kaiser, if I'm right, has built an internal testing procurement supply system. So this is what we really need to do. It's going to be our biggest challenge, and that's important because as we come out of this, as we continue to bend the curve down, and we reopen our buildings and our schools and our businesses, we want to be able to test people as they come back so that we can give confidence to clients and parents of children to keep schools open and the like. So this is our next great challenge.
Next question, we go to Keith with Coma.
Hey, Governor, how are you going to enforce all these issues over this weekend? It's going to be sunny. People are going to want to go out to ocean shores. They're going to want to go to Yakima. How are you going to enforce this? Are you going to have to use some police powers?
Well, we have a very powerful system working for us, and that's the common sense of Washingtonians, the fact that they love their loved ones, the fact that they feel that this is a patriotic moment to protect your community as well. And that's working. Look, there's massive compliance with our order. We're very gratified by that. But when you think of Officer Kurt Inget, the Bainbridge officer I was telling you about, he went out and rescued some kayakers that were in distress, and he was commended for that. He did that because of a sense of community obligation. And the least we can do, in his memory, is to just exercise a little bit of that contribution and willingness to help our community and ourselves and our loved ones. And that's the most powerful force. But yes, this is a legally binding order, and there are mechanisms of enforcing it. Businesses do need to follow this. We've had discussions. There's been just a smattering of businesses who have not complied, and they've been contacted by our emergency command authority, and almost all of them have then, after a call, agreed to join the rest of Washington. So this has been really successful. This is actually a misdemeanor if you finally don't cooperate with this rule, but we don't want to have to get to that point.
Next question comes from Joe with the Seattle Times.
Governor, two questions on the stay-home order. Have any actual enforcement actions been taken against businesses that have not complied at all, even after being contacted? And given that some of the most favorable coronavirus projections depend on social distancing restrictions beyond our May 4th order, some of them go to May 30 or later, are we going to have to extend the stay-home order?
Well, yes, there has been, quote, enforcement. We've had calls go out to people, and to my knowledge, I think most or all of them have worked. After a discussion, people have seen the wisdom of being on the team, and a little encouragement has been successful. I don't think there's been any necessity of any criminal prosecutions at the moment. Our order is through May 4th because that's what the epidemiologists tell us at the moment, that we're almost certain that we need this social distancing to be effective through, and I think the graphs I showed you indicate why we believe that. Is it possible that there will have to be actions after May 4th? Certainly there is, and we will make decisions at that time based on the data and the science and how much progress we're making. And I know people are very eager to lift this as soon as possible, and the way to do that is to comply with this effort and do social distancing as much as possible. The more of us that do that, the sooner that we do that and the more intensely we do that, the faster we can get back to business in the state of Washington. And the kind of good thing about this, you don't have to be governor or CEO or anything else. We can all do this as sons and grandparents and neighbors. When we go shop for a neighbor who might be age 70, and if we shop for them so they don't have to go to the grocery store, that's a big deal right now, and we can all participate. So I hope people will.
Next question comes from Jim Camden with the Spokesman Review.
Governor, do you think we will need extensive testing for antibodies or usable therapy or vaccine before the state's economy can be allowed to get fully back to its functional phase?
I don't think we know the answer to that. It's going to depend what the data is showing us at the end of the May 4th period. I can certainly see a scenario where we can get back, even though we do not have massive antibody testing, but we do need much more extensively virus testing because that actually tells you whether you have active disease at that moment. The antibody testing tells you whether you might have had it in the past. The more acute need will be to determine whether people have active virus, and so that's what I would consider the most important at the moment. But again, this depends on what things look like at the beginning of May so that we can make the wise decisions going forward. But I also want to say this, though. For those of us who, you know, this can be tough, changing our lives, and we all have changed our lives to some degree. The one thing I want to tell you is that this can work. That's maybe the most important message here. What we are doing is working. The modest sacrifices or big sacrifices we're making today are having an impact. They are saving lives. We're going to have grandparents who are alive for a lot more birthday parties with their grandkids because of what we're doing here today. And so this is a worthwhile investment of a community spirit, and I'm glad people are making that investment.
Next question comes from Essex with Cairo.
Governor, if you don't get the compliance that you seek this weekend, if more people go out this weekend, how much more likely does it make it that you will have to extend your stay-at-home order?
Well, I don't think there's an algebraic equation that I can tell you what percentage change in social distancing ends up in what percentage. But all I can tell you, it's been significant. And the reason I know that is you compare our state to other states. If you look at our experience, for instance, to the New York experience, where their hospitals are practically overwhelmed, where they have hundreds of deaths every day, where you see the same thing heading in the same direction in Louisiana, and I heard Detroit is having some terrible incidents as well. We have had, dozens of tragedies a day, but we have not had hundreds, which is a possibility if we are not successful in our social distancing. So that's enough to make all of this worthwhile. And that's why I'm urging Washingtonians on in this effort.
Next we go to Mai with the Yakima Herald.
Thank you for answering the question. I have a question for Mayor Byers and a question with the governor to follow up. Mayor Byers, as you know, we have a city council member who has actively spoken in opposition of what we should be doing, which is to stay home. And I know you have mentioned that he does not, Jason White does not speak for the city. However, will the city consider doing extraction? As I know there's a consider of a censure order if he continues to say things that are opposite of what we should be doing. And Governor, we have local leaders in other states who are asking people to defy this order because they feel that they don't agree with it. So I don't know if there's anything at the state level, if you have local leaders that are trying to encourage people to not follow this order. Thank you.
Madam Mayor, would you like to start?
Yes, thank you. First of all, let me say that Councilman White expressed those opinions on his personal Facebook page, and they are just that. They are his personal opinions. They do not reflect the position of the council or the city as a whole, so I want to be clear about that. And moving on from there, I just want to encourage all of us in every way that we can to continue to promote the stay home and stay healthy order. We have here in Yakima a concert of the government and other agencies working together. We have the health district, the emergency offices, the county office, the city offices, all working in a concert of the same messaging. And we have a wide platform through the news media, through social media, online, Facebook, TV, Twitter page, where people are getting those same consistent messages of what we need to do as a community to reduce the curve and stay safe. So thank you.
Just a couple comments. First off, there has been a remarkable unanimity in leaders around the state on the necessity for us to work together on this. It's been bipartisan. It's been quite remarkable in small communities, large communities, Republicans and Democrats. The fact that there's some aberrant voices is not totally surprising. And I would say this, that, look, we have a right of free speech in our state, and that ought to be honored. But I can tell you, using your right of free speech to do something that could end up with people dying in our state is wrong. That is an abuse of a right, and I would encourage folks to rethink those things. And when you ask, who should you listen to about these issues of life or death? Frankly, it's not a city council person, with all due respect. It's a physician. It's a public health expert. It's a pulmonologist who knows what it's like to see a person gasping for breath on their final hours of life. Those are the people we should be listening to. And what they're telling us is that if we will all work together to do social distancing, we will get on top of this disease. And if we do not, we will not. So just think about what those doctors are seeing and listen to them. I think we'll do just fine.
Okay, next question, we go to Jim with the News Tribune.
Governor, there's a 7th inmate who's tested positive for COVID-19 at the Monroe Correctional Complex. DOC is not releasing information other than that number. What's your message for the families of inmates in state prisons across Washington? Many of these family members are worried that their loved ones face a potential death sentence from COVID-19 because there's not adequate social distancing.
Well, what I would say is their concern for their loved ones is every bit as deep and worthy of respect as anybody else in the state of Washington, in or out of our correctional facilities. I think we can all imagine if you had a son or a husband in one of these correctional facilities and you have a limited communication with them, the frustration and the anxiety that would cause. It is necessarily deep, and we understand it and we honor it. And it's been very difficult because this is a moment where people you love, you'd like to be able to be with them and hug them and see them. But because of the dangerousness of this virus, we just can't allow that right now in our Department of Corrections. We can't do that in our long-term care facilities either. I can't physically hug my mother-in-law, my 102-year-old mother-in-law right now. And so this is real, and we want to do what we can to protect people who are incarcerated individuals. So I can tell you in the last 24 hours there has been and before that, a concerted effort to get people who are vulnerable, who are in the institutions, particularly in the one pod where these positive cases are, into a safer environment where they're less exposed to people. I'm told that they've identified dozens of people in that pod who are, because of age or health conditions, are more vulnerable to this disease, and they have successfully moved most of them into cells with fewer people in them, like one or two other people, where you're actually in a separate room. You have your own bedroom, if you will. And they're continuing to try to get everyone into a condition like that. It has been challenging because many of the incarcerated individuals have not been willing to make some changes in their cells, and they have been quite vocal about that. And the administration is trying to work with them to get them to understand if they will help a little bit and be able to move their cell, you can get a vulnerable person whose loved one loves them to get into a cell where they're more isolated. So we're working as hard as we can to get the vulnerable people into a safer condition. We've made some progress, and that will continue.
Now we go to Joseph Thompson with the Daily Herald.
Hi, Governor. I have a quick question back to PPEs. It sounds like Washington State is sort of working on its own and in conjunction with some other cities and states across the country. You've been calling on federal leadership for this for a long time. Do you think, with the state of the federal stockpile, that's something that is at this point realistic going forward?
Oh, yes, it is very realistic. The president has enormous power that he can bring to bear on this, including the Defense Production Act. He can actually order manufacturers to start making equipment, even if it may not be in their exact line of work. And it is clear to me that, particularly involving the test kits, that we need a more aggressive federal action on this. Look, it's easier to find a manufacturer to make swabs of a particular nature nationwide than it is for me to just find it just within the state of Washington. And so I continue to urge the president to exercise that authority in a much more ambitious way. And I got to believe that we're capable of making swabs in some manufacturing plant in the United States. And we are ramping up our ability to the extent we can in Washington. We've increased an order. There's a company in Spokane that makes transport medium where you put the swab in and it has to have a particular liquid to preserve the virus for testing. We have significantly increased our access there. We have had what we hope will be a breakthrough with the swabs today if it's validated. It's a different kind of swab, but we need to prove that it works, and we hope that'll happen in the next few days. We have outdoor research making hundreds of thousands of masks as soon as they can get this new machine in. We've got people making masks all over the state of Washington, and we appreciate all those efforts. But we need the nationwide manufacturing capability, just like we did in World War II. And the president can help us more. I've talked to Vice President Pence several times, and I appreciate his willingness to talk to us about this, but I hope the president can help out.
Last question, we go to Hannah Scott with Cairo Radio.
Hi, Governor. A quick two questions. One, short of the president doing more to help us get more test kit supplies, how do we move forward and get out of this without broader, widespread testing? What's the backup plan? And then quickly, can you share your assessment of what you know is going on with our long-term care facilities in the state?
Yeah, our long-term care facilities, we have a lot of concern about them because we have multiple facilities that have COVID-positive patients in them. And we are really trying to be intentional to make sure they use every possible infection control protocol and that they have the best, latest, up-to-date work to do that. We are asking the federal government to allow us to use some of the public health specialists that are now in the state to get them to go to the long-term care facilities. We've been able to have some really good results in Yakima, where the Yakima hospitals are building up capacity which can free some of these public health officials to go to our long-term care facilities to try to prevent a spread in these facilities. And we hope that that is very successful. We have seen it be successful. At Culver House in the Ravenna neighborhood in Seattle, they had a positive 1 or 2 cases, and because they were able to do testing and because they were able to do good isolation, they essentially stopped the spread of that disease pretty much cold, as I understand it. And we want to have the same success in other long-term care facilities. But again, this comes back, not only do we have to have advanced infection control in these facilities, but we also have to have testing capability. And that's what we're working so hard to get as quickly as possible to these facilities. I want to thank people too. It's been very difficult for families who have not been able to go in and see their loved ones in these facilities. And we've seen a lot of pictures of people, you know, saying hello through the window. That's tough, but it is necessary for health and safety reasons, and I hope people can understand that. You ask about a backup plan. I'm not sure what you exactly mean, but I just kind of look at failure as not an option here. Look, we have to have PPE for our nurses and emergency responders. We have to have testing capability, and we've got to use every tool in the toolkit to get them, and we're doing that. I mean, I've been on the phone the last few days with CEOs and others of manufacturing companies that make this, searching everywhere I can to get this for people. And that's the kind of effort we need to keep making.
Any final remarks?
No, I want to thank everybody. We thank our 4 local leaders again. This is a time to enjoy our neighborhoods. This is a time to enjoy beautiful sunshine. And this is a time to enjoy over 6 feet of distance with other people. And if we do all those things this weekend, we're going to be healthy next week. And that's what we need to do. Please wash your hands. Thanks a lot.